Okay, so fibular head. You have to find the bump on the lateral side of the leg, top of the lower leg. Okay, fibular shaft is the fibula bone all the way down. Then at the end, the bump is the lateral malleolus, right here. Tibial plateau, if you bend her up, remember last year I taught you the joint line here? The top part of the tibia is the tibial plateau. Tibial shaft is the tibia that you can feel, the bone you can feel in the front. Medial malleolus is the end of the tibia, right here. Dome of the talus is how I taught you to palpate the talus last year. This is the dome of the talus, so you have to put them in plantar flexion. The calcaneus is your heel. The sustentaculum tali, if you go off the medial malleolus, you'll feel a ridge. So you just come straight down from it, and you'll feel this ridge here. That is the sustentaculum tali. Okay, peroneus longus starts at the fibular head, comes down behind the lateral malleolus, underneath to the inside of the foot. Its job is to pull your foot out like this. We could probably see Lindsay's pop out there. Right here, probably. Pull your foot out. So this is probably peroneus longus. It's kind of hard to tell which tendon is which. But peroneus brevis is from here down to the base of the fifth. Okay. Then you have your anterior talofibular ligament, first one sprained in an inversion ankle sprain. Sits right here in the sinus tarsi. Calcaneofibular ligament, straight up and down from the lateral malleolus down to the calcaneus. Posterior talofibular ligament sits right behind it, so they move right around the lateral malleolus. Anterior tibialis, if she pulls her foot up hard, you can see that muscle right here, and then the tendon comes down here into the top of her foot. Okay, so it stops right here. Extensor hallucis is right in here, and it brings up her big toe. So if you have her extend her big toe, you can see the tendon pop up there, and it goes right through here, and then the muscle is right here. Extensor digitorum is more lateral, but it comes down and it goes, the tendon is right here, and then all four of them fan out into the little toes. Okay, peroneus tertius is also in the anterior compartment. It sits here and comes down to the base of the fifth. So in your anatomy pictures, it goes like this, down to the top of the base of the fifth. Anterior tibiofibular ligament, if she relaxes her foot, remember that's the one sprained in a high ankle sprain. It sits right here on the anterior side, connecting the tibia to the fibula. Posterior tib fib sits right back here, like this. Okay, so it'd go under the under the Achilles, from the fibula over to the tibia. Okay. Posterior tibialis, these are our three guys. Remember, Tom sits most medial, closest to the medial malleolus. Comes down here to the bottom of the foot. Then flexor digitorum runs next, and it comes down to all four toes. Flexor hallucis sits right behind that and comes down to the big toe. Deltoid ligament sits along the medial malleolus, right underneath of it. It's that big band right there. Gastroc, your calf. Soleus, this right here under your calf. Achilles tendon is the tendon there. And then, that's it, I already did posterior tib fib.